everyone. My name is Omawumi Ogbe, Managing Partner at GLG Communications, and I'm also a certified life coach. So the issue of mental health is is one that I'm very passionate about, and I'm so excited to be here with two amazing ladies doing great work to discuss this. First, I'm going to introduce Busi. Busi Roberts is the head of health for Edelman Africa. She's a seasoned communications practitioner with over 20 years experience in the healthcare industry, which includes international medical insurance, health risk management, disease management, and medical aid industries in South Africa and across Africa, as well as the consumer goods industry. She's worked for and supported organizations such as Colgate, Palmolive, Aetna International Private Medical Insurance, Umvuzo Health, Alliance MidMed, and RX Health. She's passionate about health and using communications to help make a difference in the health of people. Very excited to have her in the conversation today. Hello, Busi. How are you feeling today?
Hi, Oma. I'm doing very well, thanks. I'm honored that I can be part of this very important conversation on mental health, particularly in our industry, because most of the time we are solving for our clients' problems and finding solutions for them. But this conversation is allowing us to look inward to what we're doing for our workplaces and, to make it a place that's conducive to good health and mental wellness. So, yeah.
I love that. I love that. Thank you, Busi. I look forward to a great conversation. Hello, Liesl Williams, our next speaker. She's the managing partner of Razor PR in Cape Town, South Africa. Formerly with Engage BCW in Nairobi, where she served as a strategy partner. Liesl has an extensive background in communication. Prior to this role, she led a team at Atmosphere Johannesburg and held the position of Deputy Managing Director at Ogbe PR with a wealth of global experience spanning various industry sectors. Liesl specializes in crafting effective communication strategies, and I'm very excited to chat with her today on the topic that we are, looking at for this very important day. How are you feeling today, Liesl?
Good, thank you for having me. I think it is an important topic, and it's a very topical topic in light of what's happening in our world today. And in our industry, where we have a lot of bosses, we have the client who's the boss, we have the media and channels who are a boss, we have our own bosses. We live under vast amounts of stress, and I think that's sometimes a little bit underestimated how stressful it is. And then that needs a bit of support. And in the leading up to now and even into the pandemic, I'm not sure we provided the right kind of support. And I think COVID has taught us that we have to make sure workplaces are more than just workplaces. They have to look after you and hold you.
I like that. I think that's very powerful. So I'm going to come to you again, Liesl, for my first question, because you've touched on it. October 10th, every year, is celebrated as World Mental Health Day. How important is it that as an industry in public relations, in communications, we are discussing this and looking at it?
I think in every industry, it's important. No less so or more so in ours. I just think agency life in general has not always looked after that. It's a high pace, high movement, high speed, high performance. And all of those things are good. And if you've lived a long time in agency life, it means that you probably get a huge thrill out of all those things on a good day. So it's about that balance, though, of making sure that as agencies, we support both sides and we give spaces for everybody to grow in a way that nurtures them and allows them to be authentically themselves in the workspace.
Very nice. Thank you.
Yeah.
Busi, would you like to add something to that? What does it mean to you to celebrate World Mental Health Day, not just as a day to, paint a brush and something like that, but to really celebrate it and take the actions?
I think for me, Liesl touched on obviously what the kind of industry, the kind of environment we have in agency life. So for me, I had never been part of an agency life until this year, and I can now look at both sides, from a corporate perspective and in agency life. And yes, it is all high-paced and all of that. And me having worked for healthcare organizations themselves, like medical aid schemes, etc., you would think that mental health is a top priority, etc. So I want to agree with Liesl to say this isn't just important within this industry, but all organizations should be, because when I worked in that space, we were always finding solutions for our clients, the ones who are paying, what mental health solutions we'll bring for them, for their employees. But very rarely did we stop and look internally to our own employees first, but unfortunately that is changing. And with my conversations with other employers, particularly when I share the trust in health data. Another colleague from a big client, a health client out in Africa, she actually also remarked to say, we are a health organization, but to be honest, we have never really taken the time to ask ourselves, what are we doing for our own employees? Over and above the standard employee assistance program that everybody has, and they say, if you have a problem, phone that number and whatever, you'll be sorted. But actually being intentional about creating an environment that's enabling and an environment that makes it okay to say you have an issue or you have a problem. So I do think really this is much wider than just this industry, and not just the agency life as well, because as I've said, I have seen both sides now, and I can agree that it's something we tend to overlook from an internal perspective, but we do talk about it, we write about it. You know what I mean, for external consuming, but not really as much for our internal purposes, which is what needs to be changing.
I like that. What do we see about coming to you now, Liesl? What do we see about the agency life? Someone was telling me, a client of mine was telling me that in your business, there's always there's always an emergency, there's always a breaking news, you are always on the move, it's a high tension environment. How can, employers help their employees, practical things that we can do better to ensure that people who are in this high tension environment are getting some sort of support that they need to be better in their lives and in their profession?
Well, I think those things aren't going to change. We are always going to be in cycles of breaking news, of crisis comms. So what we have to do is give people the skill sets and the tools and the support to manage them without that affecting their mental health negatively. So we can't really change our world. We can only change how we react and respond to our world. So I think it's important that people are who are onboarded into this business and into any company, I guess, in a way that allows them to find what they need, whether that's the balance in a work-life balance, whether that's a little bit of flexibility, whether that's getting some kind of employee assistance program support, whatever it may be. Coaching, coaching is such a powerful tool, whether they have like a buddy system inside the agency where they've got their peeps that they can talk to when things are tough, understanding all of that, but setting them up to win, because that is ultimately what we need to do. We need to empower them and enable them with the tools to win, because we can't change what's happening on the outside, but we can absolutely change how we manage that.
Oh, I love that so much. Setting them up and empowering them to win. Busi, you have an extensive experience in health. You are the head of health for Edelman Africa. And so what are your experiences that you've seen, some common mistakes that organizations are making where it concerns the employees and the people who make the organization?
Yeah, I think it really goes back to the culture that we create in an organization. And I think leadership has a lot of good, they need to be modeling the right behavior using that quite loosely. As Liesl just made mention of the culture in an agency environment, you know, and as people, we tend to take a lot of pride in how busy we are. You know what I mean? Oh, I'm so busy, I don't have time. But as an organization, you actually create a culture that encourages the balance. I mean, some of the things that I've seen is actually, even in previous organizations and also in where I am currently, is to actually have an agreement to say, when it's time to go home, when you've knocked off, let's respect one another's time off and be part of your family. And let that be okay. But if leadership makes you feel bad for being unavailable to be on a call at 7 o'clock in the evening, then obviously you're going to push and do that, because you don't want to be the odd one out when everybody is. But if we foster an environment that says, guys, I need you, because we need each other in our peak performance. We need each other when you are well functioning and you are actually refreshed, and you know, so the times of break are very important. So I remember being part of a team where we had those ground rules to say, guys, from this time and that time, let's not call each other. But if I get a call, then I know this one was an emergency. Then you know I can take that call. But if it becomes a norm that at 8 o'clock it's normal for you to be sitting behind your computer and finishing up, that does contribute to burnout, because you know you are too afraid to speak out because everybody's doing the same thing. You are the odd one out, and you start feeling bad as if others are saying, do you think you are the only one who has a family? We also have a family, but look what we're doing. You know what I mean? It should be made okay for you to have those boundaries, to say, it's 6 p.m. or whatever that time is, that is the cutoff that I'm going to be focusing on whatever else matters in my life. So we need to be doing that. We need to be encouraging that. And also, we need to be encouraging people to take time off for rest. Which shouldn't, you know, I mean, I've seen when you look at your HR and the policies, etc., it can really be as basic as that, where you're seeing people, they are accumulating leave from one year to another. They take the bare minimum. The reality is we need to take breaks. So we need to be encouraging that. So as bosses who've got people reporting into you, we need to be putting that as one of your KPIs of people management. Are your people taking enough rest? Because you need them refreshed. You don't want them to have burnout. You don't want them, honestly, you know, having a breakdown, etc., etc. So it's really all these little small things that become part of the culture of the organization, where it's encouraged. Because some people don't take breaks, because I know that if you've got a boss that's always there early, if you know you get there at work, she's already or he's already there, and when you leave, he leaves the last, people feel, oh gosh, I was late, or I can't leave before the boss does. I mean, if that happens, that's okay, but it should be talked about to say, you don't have to emulate what I'm doing. It's okay if you have to leave early, etc. We must make it okay. So otherwise, people find themselves adopting practices that are not healthy. And remember, our threshold is not the same. Some people can take a lot more pressure than others before they reach their breaking point. So we don't want to push everybody, because we are not the same. And as employers, as managers, whatever we may be in our roles, we need to be very mindful of that and create a culture that says it's okay to take time off.
I really like that. Busi, you've shared some great tips. I'll come to you now, Liesl. When she touched on culture, you wrote an article, a very interesting one, about the mental health, the catch-all phrase, the catch-all for all and all that stuff. And is there a thin line? You know, do you think that whilst we're getting more publicity, visibility for mental health and the importance of mental health, especially in the workplace, do you think there's also sort of like an abuse, and there's a thin line making some things that are not really mental health issues to become mental health issues? And how can we, avoid some of these things? What can leaders do to ensure that we're addressing mental health issues in the workplace as they are?
As Busi said, culture is a complex and interesting thing that starts at leadership. But I do think what is happening is that mental health has become a little bit of a bucket. And every time something's wrong, we put it in that bucket. It's almost become, oh, well, that must be a mental health thing. But sometimes you have a culture thing. And sometimes an employee is just not the right culture fit. They're a great person, but it's like putting a seed in the wrong kind of soil. That doesn't mean there's a mental health issue. It means that there's a culture issue. And sometimes there is a performance issue, and it's just a performance issue. It isn't a mental health issue. And I think as leaders, we need to be able to differentiate kindly, very kindly, around what is actually a mental health issue, so that we make sure that that person who has got a mental health issue gets exactly the right support. I would hate to see their issue diminished because it's ended up in a bucket full of other people's issues or non-issues. And then it stops becoming important and we lose the focus. And I think that it also stops us then from correcting the wrongs. Because if we have a culture problem, then we should be correcting culture. If we have a performance problem, we need to be working out how we upskill and train and manage the performance issue. If we just always put everything into the bucket of, oh, it's a mental health problem, we're not managing the root cause. The problems won't go away. And in turn, that's not good for your business.
I really like that. Very well said. Busi, still on the issue about the culture and all that, what do you think, someone who has all of these experiences in health, do you think leaders need to, get some sort of learning education in not just not about physical, but also emotional and mental health to be able to lead better? Or how do you think they're able to even differentiate some of these issues that Liesl has mentioned?
Yeah, I think that's actually quite key. I think it's very important to know, it's important to have leaders who understand what are we dealing with, or if they don't, they actually get empowered in that. And I'm saying this because I've actually had an experience where a leader of an organization, his own personal views is that there is no such thing as mental health. There's no such thing as depression. And they were quite vocal about it, to say, we just need new friends. You know what I mean? So when you are that dismissive, that says a lot about what measures you put in place to assist your employees. And then sometimes, and we also need to remember the great responsibility that you get given if you become a leader. And some things you may, in your personal point of view, differ with. You understand what I mean? But at that point, you are not necessarily there representing yourself, but you are leading this organization, people with different beliefs, etc., etc. So you need to be coached and developed to be able to do that. So it's very important that as leaders, you need to acknowledge what is happening, and things are different now, because we tend to say, when I was your age, when I was growing up, when I started working, we didn't have any of these things. You understand what I mean? We need to understand that the world is changing. There's a lot of things that have changed. I mean, there's lots of sources. I mean, I'm also not a medical professional by any means for me to say, what are the origins of mental health? Why are we having more cases now than we did before? But the reality is, it is here, and it needs us to manage it. It needs us to put plans in place to you know what I mean, to manage it for the betterment of our organizations and for our employees. But I do agree with Liesl. If we do not define it properly, and everything then just put under the umbrella of mental health, it does weaken it, because every time you hear about it, you think, oh, not another one again. You know what I mean? Because now we will be dismissive of it, because everything was then just put under that. So it's important that we use the right terminology for the right thing. You know what I mean? And it starts with our everyday conversations. How often did we use, you know, in very casual conversations, the word that I'm so depressed? You know what I mean? That when a person is actually dealing with real clinical depression, people think it's the usual, feel bad or sad or whatever about something, while it actually means something completely different. So as leaders, to be able to name things the right stuff, in fact, you don't, even if you, it doesn't mean the CEO of the business, but whoever is in that leadership position, people who are empowered to look into this and actually realize that it does matter, because people are our greatest assets. We say that all the time. Your staff, the people who work, that make the business work, they are your greatest asset. And if that is the case, what are we then putting in place? So that it really is important that we empower leaders, that and we develop leaders that have empathy for people, who understand that these things can happen. The fact that it's never happened to you, the fact that you've gone through worse things and you were fine, that doesn't invalidate somebody else's experience. And that is very important. And I have seen it happen, I've heard it happen, and you get shocked that, how as a leader can you actually even verbalize that? Yes, it might be your belief, but you are leading all these people. So we have to be very sensitive and mindful of what we say, because that contributes to that culture that you are building. That in this place, nobody suffers from mental health. You must get on with the program. So, yeah.
Okay, still staying there. Thank you, Busi, for the insightful contribution. I'm coming back to you now, Liesl. Looking at, we were talking about how mental health, you know, shouldn't be all in one bucket, right? I think also same with location, region. For example, what will work in Europe may not work in Africa. And Africa has so many countries. Africa is not just one place. Okay, I am from Nigeria. You from South Africa. Okay, even inside South Africa, somebody else is from Johannesburg, from Cape Town. There's all of that. How do we look into that part when dealing with the situation of mental health in our different, you know, places, and even with the kinds of interventions and, you know, things that we bring in when we look at now the culture of the place, of the region, or the way the people are in bringing out mental solutions?
So it's very interesting that, because I always think that, so South Africa is completely different to Nigeria, it's completely different to Kenya, it's completely different to Zimbabwe, which is just on the other side of our border. And people in each of these countries are facing very unique issues and situations, some within their control, some wildly out of their control. And in some places, there's a lot more openness towards a mental wellness and mental health. In others, not at all. So it's very tricky. So there is definitely not one sock that fits all feet. It doesn't work like that. And as leaders and as businesses and as corporate and actually as communicators, our job is first and foremost to break the stigma, so that anybody who needs help doesn't ever feel like asking for help will have an even more negative impact on their life. And we can do that with our clients, we can do that as agencies, we can do that as individuals in what we say and how we treat people who maybe are going through a difficult time. And going through a difficult time is not necessarily a mental illness, but it does mean you need support. And being there, making people feel safe about where they are and that they've got someone around them that will hold them up at that time is critical. And we can do that just as friends, never mind just as business leaders. And I think that's the kindness aspect. And no matter where you are in the world, kindness is really the only currency that matters. And that as leaders And as communicators, we need to put that at the forefront of everything that we do. And if we tried a little bit harder and we spread that around a bit more, I think there's a lot of geography issues that wouldn't matter. There'd be a lot of mental health issues that wouldn't matter, because kindness would actually almost in its own make people feel safe and held and not spiral out of control.
I like that. Kindness is constant regardless of location or size or age or whatever. And that is something that we can do. I like that. Also, you touched on as communicators a responsibility, because I know that where there's a new policy that needs to be put in place, or even the COVID vaccine, for example, you know, these are things that you need communicators to help to push and create visibility and acceptance for. Busi, if you'd like to touch more on that, what more, because you're passionate about communications and using that for health, for good, and all of this work that you do, how can we use, what else can we do as communicators to ensure that we are, especially in Africa, right, to ensure that we are really pushing the word out and giving mental health more visibility and reducing the stigma that is still today attached to mental health?
Well, I think maybe the approach there would be twofold. We are trusted advisors of our clients. And I think we don't communicate for the sake of communication. We are moving towards being strategic about it. And to be a trusted strategic advisor for our clients, it is also for us to put on the table some of these things that we see, because we're privy to information, we're privy to strategies that our clients have. And when we see gaps, I think we would be doing a disservice when we do not mention that to the client, to say, we see, here's your internal comms strategy and all your employee engagement strategies, etc. But I'm seeing there is something that I'm not seeing, something that's missing, which I don't think, if you want to create this environment that you want for your people, you can do without. We've got that opportunity to do that. I mean, we speak to the highest people in organizations that we are advising, CEOs and what have you. So I think we do have that duty to advise them accordingly and put the spotlight on areas that they might have overlooked, because we have access to this. And then secondly, in our own roles, so not necessarily as an advisor to a client, and as we are now, we are having a conversation as people who are part of this agency. And we have the tools to communicate, not on behalf of our clients only, but we communicate on our own behalf. We have access to this. How are we using this? We should be putting out thought leadership pieces, not ones that are paid for by clients, but ones that, because we feel we need to be advocates for these conversations. So we've got those platforms, and we really have that advantage that we know exactly how to get the right messaging through the right channels to the right audiences. This is what we do. It's our bread and butter. But what are we doing to advocate for those right messages without being a client-led initiative? So that's why I'm saying it's twofold. And then going back to Liesl, as individuals, just as people in our own communities, in our families, in our spaces where we've also got a different kind of influence, where we can bring these insights that we have, because it really takes a village to make a difference. You know what I mean? So in our different areas of expertise, different areas of influences, this is the conversation that we should be taking forward, of mental health or anything else that is of societal importance.
Thank you, Busi. That was very well said. I'm just going to stay with you for a moment again. I'd like for you to talk to us about the Edelman Trust, the research and the survey that your company have done. And it's very interesting. I was reading it earlier. Very interesting in the area of health and what people want from the companies. Can you touch on that for a little bit?
Yes, so annually, Edelman, we conduct what our trust barometer in different markets. So in the last few years, we also just focused on health in terms of what are people saying, what are they expecting. So the findings are really quite interesting that in many countries, South Africa being one of them, people trust their employers more than they trust government and health institutions to actually care for their health. And they're actually expecting employers to play a bigger role in their health than they are right now. And by health, I mean, in South Africa, Liesl, you would know, most employers would make a financial contribution towards somebody's medical aid, and most of the time, and then have an employee assistance program in place. But usually, that's as far as it goes. And we see that as we've taken care of yourself, of you, if you're sick, you've got medical aid, you can go to the doctor, you can go to the private hospital, at least you don't have to be in a public facility. But usually that's as far as it goes, as far as the employer role has gone. But research shows that people are expecting more, employees are expecting more from their employers. And in terms of what they do, they're expecting them to really play a more active role. So, and it's more than just having one corporate wellness day annually, where you've got one of those providers to come and check somebody's blood pressure, stand on a scale, take their BMI or whatever. It really is putting all sorts of measures in place. So that is the expectation. But what we are finding, which is also quite promising, the fact that what the employers are doing seems to be already more than what the government is doing, what other health institutions are doing. So this gives an opportunity for employers to look inwardly. So I think when we look at our retention strategies, you know, how do we retain our employees? What we're offering them from a health perspective becomes also quite critical to say, how can I make this a better place to retain my best talent? So this is just really data that informs us, what can we do better? What can we do more of? What can we do less of? But there's a lot that expected from organizations to do more for their employees from the health perspective.
Thank you so much, Busi. This was very insightful. And this then brings me to you, Liesl, and to the question, what can smaller agencies do? Yes, big agencies can have all of these things for their employees, for their teams, but smaller agencies that may not have these resources, how can they support? What are little things that they can do to support their employees better, or really just help them to boost their mental health?
Look, I think one of the joys of being in a very small agency is, or a small company, is that you are far more able to create individual solutions. The bigger you get, the more your policies come into play, and they're bigger and blanket policies. And it's hard to separate one from another because you have to have a baseline of how it will work. Whereas when you're a small agency or just a few people, you can actually, each person individually, you can work to their own needs and their own personalities, really. And so in a small agency, you might find that there's a mum with really, really young children, and she cannot find a way to get herself to the office until 9:30 in the morning. And because that's how her life goes. And so you can work around her in that way. So I think that's the joy of a small agency, is you may not be able to offer wildly big medical cost covers and employee assistance programs, but you certainly can treat everyone on an individual basis and give them a space where they can be their best selves. So if their best selves means that they have to go to gym at lunchtime so that they can use the treadmill or the boxing bag to get it all out their system so that they can come back after gym like a new person, you can do that. So I think that's what it's about, is finding what you can do as a leader, whether it's an agency, a business, or anyone else. What can you do? as a leader, as a parent, as a teacher, as anyone, to make sure that someone is seen for who they are and for what they need, and to try and meet them a little bit where they are. You can't always meet everyone exactly where they are, but at least meet them down the road. And I think if you do that, you're already solving half of the problem. Because that's all we really want, isn't it? For someone to kind of see us, recognize us, and honor us for whoever we are.
I like that. You can't meet everyone everywhere they are, but you can meet them down the road, meet them down the road. And the personalized solution, that's very helpful. Now I want to go personal, us, right? So we can share some practical tips, seeing as you're both leaders who have gone high in your career. I'm sure there's some things that you've learned and unlearned and relearned. What are some ways, some things that you do that have helped you personally to boost your mental health? I'll start with you, Busi.
Yeah, no, it's an ongoing learning, so I don't have all the solutions, but because I continuously discover ways to manage that for myself. So, but for me, it's really as simple as having time to spend with my family. Because when I'm stressed about not having enough time, when I'm stressed that I am missing out on key moments in my children's time, then that does affect me. It does affect how I perform at work, etc. So it's really important that I do that. I often said to somebody, because I work in such a really fast-paced environment, etc. When somebody said, "Oh, Shane, your children must really be struggling if you're never there," and I said, actually, I'm very intentional about how they experience me as a mom. I said, so as busy as I am, that's not the experience my children have, and I'm intentional about it. That's why when I get home, if you phone me in the first 2 hours when I get home, I don't know where my phone is at that time because I never took it out of my handbag. I put it down, I go straight, and then I'm a mom for those 2 to 3 hours before it's their bedtime. It's homework, it's catching up on their day, how's it going, it's preparing dinner, it's all of that, because that for me, it's something I don't want to compromise on, because I don't want to have a regret in that area as far as possible. Then if I have to complete a presentation I was doing later, I will do that once they've gone to bed, but at least I'm not suffering from the guilt, because guilt is a big contributor to mental issues, and mental health issues, because you feel so bad for have not been there. And having and working for an organization that allows me to be able to take time off, like Liesl was saying, to go and watch my child's play at 3 o'clock in the afternoon, or whatever, those things are part of what feeds me, But apart from that, going to the gym or taking a walk and just breathing in that fresh air, it really does a lot to help me feel less stressed. And of course, I love going for massages. Everybody knows, if they don't know what to get for me as a gift, just give me a voucher to one of my favorite spas. I can never have too much of it. Or I actually go for a hair wash. Nothing like a scalp massage. That's my favorite. I literally feel the tension leave my body. You know what I mean? And then I love reading fiction as well. We do read all of these serious books where you learn things. But to de-stress, I read fiction where there's characters that I can just be lost in their world and really imagine who they are and all these places they're discovering. And that really does wonders for me. So yeah, those are some of the things that I do.
I like that. I like that, especially the fiction part. I like to read fiction as well, and to watch mindless TV, movies, and just enjoy that with a glass of wine. Those are great. Liesl, do you want to share yours? Some tips that have helped you to boost, especially as concerns.
Clearly, wine and reading is a theme, so we'll stay with that. But I think that I learn constantly and things shift and change. But one of the things that I use a lot and I try and work with my teams on is making sure that we're framing things right. Because when you get stressed and a little bit overwhelmed, you lose your ability to frame with perspective. And the truth is that we've all had a difficult client, but a client doesn't want you to fail, because if you fail, they fail. So you need to always try and reframe when things are getting tough, that somehow it's actually a communication issue, and that between the two of you, things are not working because the communication isn't there. And when a piece of writing just doesn't seem to work, reframe it. Because when you get too caught up in the emotion of it, it becomes so hard, and you overthink. You cannot work in this industry if you're not an overthinker. So we all overthinkers, and we do this thing, and we wrap ourselves around in knots. And the knots are unnecessary when we have to take a step back. And sometimes that's taking a walk around the block. Sometimes that is that massage, Busi. Sometimes it is just switching your phone off for a few hours, but to reframe so that you tackle it from a new perspective. And everything can shift. If you can change your frame, you can change the picture.
I love that. I love that. I love that so much, Liesl. Also, for me, if I add is, I think it's also like Busi was talking about, it's okay. You touched about that also when we were, discussing. I want to tell today's professional, even the leaders, that it's okay to take some time off. It's okay not to be always on the move. I am someone who, before now, if you email me at 2 a.m., sometimes now I would respond, yes. You are bound to get a reply. There are people who would be like, I have never seen this kind of person in my life, because I was always on. But now, Saturdays, I drop my phone somewhere, like, Busi said, I won't even see the call or the WhatsApp message, as there's WhatsApp is now encroaching into our private time, into our work life, because more people are using WhatsApp as their communication tool. And so your client is sending you a WhatsApp message on a Saturday or Sunday. For me, I'm going to respond on Monday. It's okay to not always be on the go. It's okay to sleep for 7 hours, 8 hours. It's okay to take a break, just get your job done. Like, with the article that you had written, Liesl, not, it shouldn't be a performance issue. But we need to also know when to take a break, especially as PR and communications is one of the, high tension courses. Thank you all so much. It's been such a great conversation. However, if you have one last word from both of you, I will start with you, Liesl.
I don't really have a last word. I just always want to remind people that it's supposed to be fun. It's not all supposed to be hard. So try and look for your joy and find the fun, even on the worst possible day. And that's not undermining a bad day. Just look for the joy, because it'll change everything.
I love that. Busi?
I would really say, you only have one life. I'm talking to an individual now. You only have one life. And if you feel that something is off, it's your responsibility to ask for help. And your body will tell you. Don't wait until your body crashes underneath you to go seek help. Look out for the signs and put your hand up and say, I need help. I'm struggling. You'll be surprised how many people are actually willing to jump in and assist you if you just ask.
Busi, that is the best message.
I think this is the most powerful way to end this conversation, Busi. Thank you so much, Liesl. Thank you, Busi. I have enjoyed our conversation. And to everyone watching, thank you for joining us. And if you have questions for Busi, if you have questions for Liesl, how can they reach you? On LinkedIn, where can they find you?
Yeah, you can find me on LinkedIn under Busi Roberts. You can, and you just befriend me. What do you call it on LinkedIn? You send a friend request, send whatever, connect request. You can find me, and I'm also on other social media platforms, Busi Roberts, that I don't think there's many of us, so that will always lead you to me.
Liesl, how can they find you?
Definitely LinkedIn, friend request, connect, whatever it may be, but that's the one. LinkedIn's always a good place to start.
Awesome, awesome. Same. I'm on LinkedIn and Instagram, Omawumi O. So I look forward to connecting. And if you have questions for our amazing speakers, please do so. They'll be happy to answer. Thank you very much for joining, and happy World Mental Health Day.